children ever have this condition?
Children do have it, and it's ever more common now in children because of the problem with obesity in children. Also in children, the other issue is hypertrophy or enlargement of the tonsils and adenoids, and you can have a normal weight or thin child with sleep apnea due to enlarged tonsils or adenoids, and that's one of the reasons why children have their tonsils and adenoids taken out. So that's sort of a separate issue. Adults, of course, in adulthood, our tonsils and adenoids atrophy away gradually, and by the time you reach adulthood, most of the time they have atrophy to the point where it's not a problem, although occasionally it is. But in children, it's quite common to have tonsils and adenoids enlarged enough to cause a sleep apnea syndrome.
So people who really have no concept that this is happening to them all night long feel pretty rotten the next day, I'm guessing.
They do, absolutely. One of the other hallmarks, we mentioned snoring as the hallmark, of course. The second hallmark, as we mentioned, is daytime fatigue. And this daytime fatigue can really be quite severe and quite a problem, not just a bother. I mean, we all like to feel refreshed and ready to go and full of energy during the day. People with severe sleep apnea often almost cannot stay awake during the day. By midday or early afternoon, they are so tired that they can barely keep their eyes open. Those people are much more likely to have car accidents from falling asleep driving a car. They're also more likely to have accidents at work if they're, say, operating machinery or doing something critical with a machine that's potentially dangerous to themselves or to someone else. There's a much higher incidence of that kind of accident with people with sleep apnea. So the daytime fatigue is not only just an irritation and an annoyance and making people miserable during the day, but it also can be a very dangerous factor.
So the things that we have control over are weight gain, smoking, that kind of thing, primarily. Right? What kinds of treatments are available for this? Breathe Right strips aren't going to do it, right?
Breathe Right strips. There are some issues in the nose, nasal issues, I guess we could say, that can contribute and make sleep apnea worse. Septal deviation, the septum in the middle of the nose, if that is deviated, that can obstruct airflow and make a sleep apnea patient, make them worse, aggravate the problem. If you have hypertrophy or enlargement of the turbinates, which are sort of the baffles in the nose, from allergies or from some other condition, that can aggravate sleep apnea. And some people do get some relief in mild sleep apnea or mild snoring. Some people do get some relief from the nasal strips. But if it's a nasal problem, that should be checked out by an ear, nose, and throat doctor. And it certainly can be a contributing factor, but it's usually not the most important factor. To get back to treatment, the most classic treatment at this point is what's called CPAP, or continuous positive airway pressure. And this is applied via a mask that goes over the nose, or the nose and the mouth, and supplies positive airway pressure throughout the upper airway to keep the airway open. It kind of holds it open, kind of balloons the airway open and holds it open.
You've brought some pictures, some diagrams. Phil, if you'll put the diagrams up on the screen, Dr. Delaney will tell us what they are.
Yes, this is a side shot of a normal airway during sleep. The patient is lying on his back, and the airflow is noted in blue. And you can see the soft palate labeled, then the uvula, which is the hip tissue that hangs down in the back of the throat, which you can all see when you open your mouths and look in the mirror. You can see the airflow going through the nose, down the back of the throat, and right into the lungs. The tongue, you can see in the mouth just below the hard palate. This would be a shot of a normal sleeping patient with an open airway and airflow uninhibited and flowing freely down into the lungs. Our next slide is an example of sleep apnea where the airway is totally obstructed. The tongue is falling back against the back of the throat. The soft palate and the uvula are also obstructing the back of the throat. And you can see the blue arrow of airflow is obstructed as it reaches the back of the nose, basically. If you can see how obesity plays a role here. With obesity, all of the tissues in the back of the throat get enlarged. The tongue gets enlarged. The tissues all around the soft palate and the uvula are enlarged. And initially, as we mentioned, in mild cases, the airflow would actually continue and move through the back of the throat, but the reverberation in the mild forms would cause snoring. As it gets worse and worse, it actually gets obstructed, as you can see in this diagram.
Next, yeah.
Now this picture shows a patient with a nasal CPAP setup, which we'll show a model of in just a second. In this picture, you can see that with a mask and an air source with continuous pressure hooked up to it, is hooked up to the patient, and using this positive pressure, the air is able to flow gently around the obstruction and down into the lungs again. Basically, the air pressure props the airway open and allows airflow.
All right, you brought some CPAP machines to show us, and if you will just show us.
Okay. Well, first of all, this is the CPAP machine itself. This is the generator that creates the airflow, and then the hose that hooks it to the masks. The CPAP machines, for those of you in the audience who perhaps have seen them in the past or have perhaps used them in the past, this is a dramatic improvement. This is a very small little device. The old machines used to be very large and very noisy, were cumbersome to use, and very difficult to be a sleep partner around. This is new and improved, high-tech sort of issue. Only weighs a pound or two, maybe, sits right next to the side of the bed with a small hose that runs up to the patient's face. And then we have a variety of airways, or of masks, I mean. This first one is sort of a classic nasal CPAP mask. This hooks up to the hose like this. You can show, that's good. So the air source hooks right up to the nasal mask, and with most people, this is adequate. Most people keep their mouth closed during sleep, and just a little small nasal mask over the nose is enough to provide that positive pressure. It's held on by a strap system that goes over the back of the head. At first glance, it looks uncomfortable and cumbersome, but with practice, given a week or two or three of gradually getting used to it, most patients are able to use this kind of system. So this, again, is the classic nasal CPAP, nasal continuous positive airway pressure. A newer version of that, and a little less cumbersome and well tolerated by many patients, is called the nasal pillows. And in this system, rather than an entire mask over the nose, which some people find bothersome, there are just two small little soft pillow type rounded catheters that go into the two nostrils. And the seal, there's enough of a seal around each one of those to prevent the pressure from being lost. So that's a sort of a newer version of the nasal CPAP. And then for patients who can't use just the nasal because they open their mouths and the pressure is lost out the mouth, some patients use a full mask which goes over the nose and the mouth, and similarly hooks up to the pressure source. And there are actually several more varieties of different systems. Often when a patient is diagnosed with sleep apnea and it is suggested that they use CPAP, they have to go through 2 or 3 different setups before they find one that they are comfortable with and that is well tolerated. But there are a number of options. Back in the good old days, 10, 15 years ago, there was just the one just one version of it, but now we're fortunate enough to have several different opportunities to use the CPAP.
Is it noisy?
Not very. It used to be very noisy.